Thank you for sticking with us and welcome back. This is our social hour on our very special programming right here on K24 this morning. We are still preparing to go live from 10 a.m. from Gusii Stadium to cover the burial of former Cabinet Minister Simeon Nyachae. He is going to be laid to rest today in Kisii County. His body did arrive at his Nyosia home yesterday. There will be a funeral service taking place at Gusii Stadium. And then what we do understand is a private burial at his home will be taking place shortly after. You can see those images on your screen. There are preparations still underway. People arriving also at the stadium as we speak. We will be covering it as from 10 a.m. Nevertheless, we still do have also condolence messages streaming in for Senator Mohammed Yusuf Haji, who passed on yesterday. Of course, quite a number of those coming in for the people of Garissa County. We do know, of course, the kind of work that Senator Haji and his role that he did play in the entire BBI task force. Quite a number of tweets also still coming in, and you can see the political class still posting on their official Twitter accounts. Senator Mutula Kilonzo Jr. says the end of a stoic gentleman. In his last engagements at Senate, he said a firm no to 1 man, 1 shilling formula. Had a story to tell, by the way, when someone missed the BBI report, and had no kind words for the arrest of 3 senators. Go well, Mzee. All right. We will continue to sample those as they are coming in. And of course, keep talking to us through our social media platforms yet again at K24 TV. We're still on our children's dental health discussion on health and wellness today, joined by representatives, the team actually from Royal Smiles Clinic. I'm talking about Dr. B. Simiu, endodontist, as well as dentist Dr. Gladys Maina with us. Welcome back, lady and gentleman. So before we went on a short commercial break, Dr. Gladys, you brought up something that perhaps a lot of mothers are shocked about. The whole idea of thumb sucking and how that really does affect a child's dental structure, we may not know about. Tell us more. Please just, backtrack a little bit and then tell us what really is wrong by allowing your child to keep sucking their thumb, even until they're all the way in kindergarten. You see it even in class 3. Yes. Okay.
So the thing is, when children are growing up, the bone that forms the jaw is still not fully formed, meaning it can be affected in terms of structure and shape. So if you have, say, a thumb in the mouth throughout, you're basically having contact at one point of your jaw. So it means if the jaw was to grow, say, normal is almost a U-shaped, when you keep pressing on it, then you're affecting how that jaw will come together. So the end result is, most often you will have a very, what you call a deep palatal vault. So it's like you're pushing it in and you're creating a depression such that it will be constricted. So if your teeth, the way teeth are, or the jaw is developed, is for the teeth to arrange themselves in, excuse me, in a certain order. But when you're already affecting the development and you end up with a very narrow jaw, it means that your teeth are going to be crowded, because they'll most often come out in the same size, and the position will also be affected. So you end up with, yes, the correct number of teeth, but their position has been disrupted by that abnormality in shape and size. So what, how we can correct this, if you notice that your child is constantly having their fingers in the mouth, we need to establish the cause. In some cases, especially for the younger ones, at around 6 months, it's because of irritation on the gum. So to avoid having a finger in the mouth, you can get toys, teething toys. You can even get, say, a soft carrot or even an apple for the kid to be nibbling on. Then as they grow older, it becomes a bit difficult to control that. So we advise that if you notice it's a persistent problem, then you take them to a dentist. In an ideal dental setup, you should be able to have your child assessed properly, and there are appliances that you can make. They're called habit breakers. So they usually have some metallic elements to them, and they are fixed in the mouth. So any moment the child tries to put their finger in the mouth, they encounter an obstruction.
Right.
So that will keep them from, it will deter them from always having their fingers in the mouth.
Okay.
And that also applies for a condition called tongue thrusting. There's a way we can, same way, having a constant contact with the jaw. So if you also notice that your child is always putting their tongue on the top of their mouth, then also that's a point of concern. Same effect as having a finger in the mouth. But then we also have what you call habit breakers for that.
Okay. Interesting to note. Remember, our question of the day still stands. Let's put that up on the screen for you just in case. What dental problems would you like to ask about, especially those involving your child? That's our question to you. We'll sample those if they're already starting to stream in, and of course I'll ask my director to let me know should there be any. We did mention slightly about the staining of teeth, Dr. Simiyu, but you wanted to expound a little bit more on that. Let me give you the opportunity to go on with that as, you know, we start talking about solutions.
Wow. Okay, thank you so much. Staining could be, there are two types, categories. There is what you call extrinsic staining. It means staining outside the tooth. Outside the tooth surfaces. And then we have what you call intrinsic staining, meaning the tooth stains from inside out. So when we begin with extrinsic staining, it's staining outside. Number one cause is poor oral habits. For example, if the child is not brushing, any food we are eating is colored, of course has got some colored pigments. Therefore, if you don't wash out or brush off that, it's going to stain your teeth. Another one cause of this is maybe, it could be also just maybe kids using some pigments while they are playing with them. They can, some of them can actually stick on the tooth forever. And also trauma to the teeth. Trauma to the teeth causes what you call intrinsic staining. When you have trauma and the tooth is fractured, what happens is the blood inside the tooth starts to clot. So when it clots, it is absorbed into the dentin, and then it appears outside on the surface of the enamel. So that is a kind of intrinsic staining. A type of another extrinsic staining could be fluorosis, although that one also happens on the inside. So treatment of these two will be managed differently, and also some chemicals or acids that a patient, a child might be playing at home might cause some kind of staining or coloring of the teeth. So management of this one is done differently. For example, extrinsic staining, a simple thing like visiting a dentist for a cleaning procedure called scaling will be able to remove most of the extrinsic staining. Intrinsic staining could be managed differently. Some of them could be congenital. For example, if a child was exposed to certain drugs as early as they were born, it could cause some intrinsic staining. Those ones cannot be removed by a normal toothbrush. Even a dentist cannot remove it. So some aesthetic procedures to whiten the teeth called bleaching could be recommended in such a case, especially when we have intrinsic stainings.
Even as young as that, it's fine for them to actually go in for a bleaching procedure or a whitening procedure.
Oh yes, as young as they are, they can go through aesthetic procedures, cleaning procedures, and then there's some procedures can be done before 18 years old, just to motivate them, improve their self-esteem, and there are permanent procedures which can be done after 18 years. So,
let's see what Kenyans are saying very quickly, and then get back to the two of you. Someone known as Wafula Samuel from Bungoma says, when your baby's gums are yellowish, what does that indicate? Good one. Let's see another one. Hello, will goat milk help in the development of my child's teeth since it has low sugar? Remember we were talking about sugar earlier on? Hello, Shiko. I'm Betty from Thika. I have never put a wet cloth in my baby's mouth, and she is 9 months. Am I late? She has 3 popping milk teeth now. Okay, let's stop there. Hi, Shiko. My son has only 2 brown teeth on the upper jaw. Is that also as a result of fluoride? Can it be corrected? This is Ruth in Migori. I hope you've both seen the questions. Gladys, let's start off with the first one, which is, of course, about goat milk. That's actually the second one. So let's take goat milk as we review the others.
Okay. Goat milk is healthy. It's not so much about the sugar as of the other components, the calcium, the fluoride in the milk. So it is healthy as it is.
Yeah.
The trick is in how you clean your child's teeth. As much as we say, even for factors like sweets and candies and whatnot, they are allowed to partake once in a while, but ensure that you keep their mouth clean after every meal, or at least 2 times a day.
Okay.
Yeah, so it's healthy enough.
Okay. Dr. Simiyu, why don't you tackle the issue of my son has 2 stained teeth? Can it be corrected? That was from Ruth in Migori.
Well, I'll tell Ruth that let the child be seen by a dentist, because there could be different causes. It could be even fluorosis. If you said it's yellowish, so fluorosis starts as a yellowish batch on the tooth, on the surface, like a yellowish band, and makes the tooth turn brown. It means your enamel, the enamel is the hardest part of a child's tooth.
Okay.
So if it's weakened by any kind of staining, it starts by turning brown.
Right.
And then from brown, it goes into darkness or a dark spot or a black spot. It means that's a cavitation.
Right.
Therefore, I recommend that she visits a dentist, and then this child be checked to see what's the cause of that staining. If it's just yellowish staining due to food debris, then the dentist will clean, and then the baby will be fine.
Right.
If it's fluoride or some kind of staining that's caused by fluoride, dentists have got these things called sealants. They're able to put on the surface of the child's tooth to strengthen or reinforce the enamel, because this tooth is weak when it turns yellow. Anytime it will start decaying, and then anytime it starts hardening. Therefore, the dentist will put resins called sealers to seal off that weak area. And then the tooth will become much better, stronger, and much appealing to the eye.
By the way, there's also the belief that people have in terms of using herbal, can I call it medicine, to, you know, pretty much deal with the staining of teeth. I mean, does that really work? Because you've got a lot of products out there promising to clean teeth, and yet we do know it's almost impossible without the help of a healthcare provider. Those products, we don't know the content. Most of them are acidic products. So the public has to be aware how much acid it is. What it's doing is eroding the stain. Apart from eroding the stain, it's eroding the enamel, the tooth. And once the enamel is eroded, what happens is the dentine is exposed. So later on, this child will start feeling sensitivity because the outer protective layer is worn off. Therefore, we have to caution the public. You must know, ask your provider, whoever is your aesthetic dentist, which chemicals they're using, how much acid, and what are the side effects. Because some people have widened teeth, Chico, and at the end, their gums are gone or their teeth starts falling. Oh, my goodness.
So some products might not work.
And sensitivity is so, like, I don't even know how to describe. It's excruciating. The fact that you just keep feeling so much sensitivity around your gums and your teeth. My goodness. Okay, so we're still working on Dr. Gladys's sound. Forgive us for that. But let's see if we do have any more feedback, or at least questions that are coming through WhatsApp. Okay, so they're working on that in the meantime. Let's continue with you, Dr. Simiyu, very quickly. When you actually talk about good dental practice, you know, how do I begin with my child? First of all, how do we start that process? Because, of course, they're always going to try and resist you putting something in their mouth.
In their mouth, yes.
Yeah, so what would you recommend for a parent?
Now, for parents, I'll take you through stages.
Okay.
We've mentioned the first stage is when the teeth are not yet. A damp cloth, you rub the gums. At the age of 2, when the teeth actually are coming out, you introduce this child to a soft toothbrush. A soft toothbrush, and we said the amount of toothpaste should be like the size of a grain. And then at the age of 3, it could be the size of the toothbrush will be the size of a pea, like a pea size toothpaste. And then you brush their teeth gently in a cycle. So you hold your toothbrush.
Yeah. Okay, I'll ask my cameraman if you can actually zoom in on that, just so that we can see how you're doing the motions around the tooth. Okay.
So the moment the first two teeth starts coming out, you have to get your toothless toothbrush. Right. They're very nice colored toothbrushes in the market.
Yeah.
And then a fluoride toothpaste if you're staying in an area where there is no fluorosis.
Yes.
Those who are staying in areas where there's fluorosis, you have to get a fluoride-free toothpaste. And then when you have two teeth in front, for example, position your toothbrush bristles, first of all, at 90 degrees, and then tilt them to 45 degrees, and then away from the gum. Tilting them 45 degrees makes you not injure or damage the gum, because sometimes parents are brushing the teeth of the children and they experience bleeding gums because you're hurting the gum. Avoid your toothbrush facing towards the gum. So once you place it perpendicular or 90 degrees, tilt it 45 degrees, and then in a cycle, gently start brushing the child's tooth. How many times, they ask? Twice a day.
Wow.
Twice a day. I have a principle. We have a principle in Royal Smiles Dental Clinic. It's called 2x2.
2x2.
It's like a 2x2 car. Therefore, you brush twice a day for 2 minutes. And the third two is you visit a dentist twice a year.
I can't even believe that much work for a child with 2 teeth.
That depends on the tooth. Yes. When all the 20 teeth, milk teeth are out, that's when you can do for 2 minutes.
2x2.
2x2x2.
2x2x2.
2 minutes. And then, you know, children's teeth, Chico, starts coming out with spaces, as Dr. Maina explained. The moment they start contacting, as early as they touch each other, introduce your child to a dental floss as early as age 3.
Wow.
And then, after you brush, ask them to spit out the toothbrush. Some of the toothpaste are sweet and they might swallow. So don't ask them to gargle with water yet. Immediately you take off your toothbrush, ask them to spit without rinsing yet. Because when you rinse, especially under 3 years, they will start to drink the water. Yes, they will
definitely swallow it,
So they are going to swallow the toothpaste an amount twice a daily forever, and a lot of fluoride in their stomach.
Okay, but Dr. Gladys, someone asked, oh my gosh, am I late? My child is 9 months and I've never wiped their gums. Well, there's someone panicking watching the show.
They need not panic. It's never too late. The thing is that they now have the information. They can start now, as opposed to just saying, I've not done it for 9 months, so there's no point of doing it forward. So they're not late. They can always start now and ensure they do it right. Then one thing I'd like to mention is that when we are going to shop for the kids' toothpaste and toothbrush, we are age specific. So you'll find 0 to 2, 3 to 5, and beyond 6 years.
Okay. Hold that thought for a second, Dr. Gladys. I want to take a look at feedback very quickly. Remember, we're asking you what dental problems would you like to ask about, especially those involving your child. We've got one here that says, good morning, Susan from Umoja. My daughter is 4 years old and has cavities in most of her teeth. Some are completely broken, and I'm really worried, though not painful. Let's stop there and let Dr. Simiu answer Susan from Umoja.
Well,
what
Susan,
do you think?
Your daughter's teeth are black because of their dental caries. Therefore, kindly visit a dentist, and they're going to remove those black stain or cavities, and then fill the tooth with a resin, a white filling. We call them fillings. So. Once they cover these black spots on your child's tooth, and then they'll become white again. And as 4 years old, we don't have yet the adult teeth. So don't recommend extraction at that early age. Therefore, let them be filled with a white filling material. We wait for at least when they are ready to get out. Yes.
Okay. Let's look at another text message, Tafadhali. Good morning. My last 2 teeth on my lower jaw actually grew towards the second last on pushing that, and that resulted to decay. What might have been the reason towards that arrangement, please? Have already extracted one. Okay, so you've got, I guess, a situation, Dr. Simiyu,
yes.
excess teeth on the jaw, pushing onto the others, trying to make room for, you know, it's like they're competing for space.
Yes, yes.
Okay. So what do you think in that case?
In that case, maybe it's called crowding.
Yeah.
And what happens with crowding, the challenge is inability to brush that area, that gap or junction between the two teeth.
Right.
So this one results to the decay, what he's talking about.
Yeah.
So what we need to do is, how old was it? 4 years old? Yeah, so we need to visit a dentist who is going to do what we call space creation.
Okay.
They're going to put some appliances, like Dr. Maina alluded earlier, malalignment or crowding nowadays, you don't have to wait for 12 years.
Yeah.
As early as 7, there are specialists called orthodontists who will put appliances in the patient's mouth, try to create space.
Right.
So once this child has enough space, even the toothbrush is going to reach that area.
Yeah.
Meanwhile, for the decayed portion of that tooth, we recommend it to be filled by a dentist and then review for an appliance to correct the crowding.
Yes.
Yeah.
Okay.
So that will help.
Okay.
Yeah.
I hope we have Dr. Maina's mic back. Okay. Let's read this one and see if Dr. Maina can respond to Amina from Coast, who says, hello, Shiko, please, my baby is 2 months old and she's sucking her thumb. Is this wrong? And please ask the dentist about plastic teeth for infants. Is there such, okay, Dr. Maina. Yes.
Okay, so at 2 months, it's not exactly a problem per se, because it's a developmental stage.
Yeah.
When this child is trying to familiarize themselves with their body parts. The problem comes in when this persists beyond a certain age, especially when they already have their milk teeth in the mouth between 18 to 24 months, and they're constantly having their fingers in the mouth. At that point in time, we'll say maybe there's a likelihood of a problem ensuing.
Yeah.
So plastic teeth, as I had alluded earlier, are teeth that are, in some cases, a child could be born with plastic-like white structures on the teeth, and others that come in within the first 1 month of birth. So those are the ones we call plastic teeth.
Yeah.
So they're quite scary, especially for first-time parents.
Yeah.
They're common. Unfortunately, in some setups, we find cultural practices that remove these teeth structures.
Wow.
Yes. And the problem is that now it's done in an unhygienic environment, production of toxins and bacteria. They end up destroying the teeth germs and the developing milk teeth. So what we advise is that if you say deliver a child and they either have teeth or they come shortly within the first 1 month, do not panic. It may not be very common, but it is not uncommon. And there is a solution. The trick is to visit a qualified oral health clinician.
Right.
Luckily, currently in most county hospitals, we have dentists. If you're not able to go to a private practitioner, then at least make the effort and visit a county hospital. And do not try to have that removed at home, cultural or otherwise.
Yeah.
Yes.
Okay. Let's see if we've got another text message, Tafadhali. Hello, Shiko. Is it recommended that you use toothpaste on a 1-year-old child? This is Chirchir from Eldoret.
Oh, yes.
Go ahead. Let's go ahead, Dr. Maina. So we've introduction of toothpaste.
Yes, as Dr. Simiyu has explained earlier, we have toothpaste that are age specific. At 1 year, you just need a very small amount, like a grain of rice, just to introduce the taste, because they have to get familiar with this. So use a very small amount at those initial ages, because the children, their manual dexterity is not very well developed. We advise that you brush for them, at least have a caregiver brush for them. And if possible, introduce these children to teeth brushing at the same time the parent or the caregiver is doing it. It's easier for the child to adapt to it when they see you doing it. So a very, very small amount that is age specific. Age specific toothpaste, preferably one with fluoride, and age specific toothbrush. And do it at the same time, at least 2 times a day, after breakfast in the morning and right before going to bed.
One of the frequently asked questions that we get here, Dr. Simiyu, is about, you know, what to look out for when I am looking for this health practitioner. And I like that because it's almost tips on how to be a smart parent. What kind of products to buy for my child's oral hygiene, how to shop for a child-friendly dentist. By the way, how do you actually get children to sit on that chair? Like, do you strap them? So we need to figure out how to find child-friendly practitioners. You know, what do I need to look out for as a parent?
Well, nowadays, many of our public health facilities have sent out actually general dentists to spend another 3 years on children matters, teeth. So most of the level 5, level 4 hospitals have got pediatric dentists.
Yes.
Therefore, these are people who are trained to calm down your child, not trapping them, holding them. And then even children who are not cooperative, these kind of specialists are able to put this child under anesthesia or sedation. So this kind of treatment involves the baby goes to sleep for a while and all teeth are sorted in one sitting. Therefore, when you're sorting for one, let parents not be afraid even to ask questions.
Right.
Yeah, I'm looking for what? A specialist in children's teeth. Are you a pediatric dentist? And ask so many questions. Some parents are really afraid, especially when the children are becoming uncooperative. And don't be afraid to ask such questions. So this, when you're looking for one, most government hospitals have. At Royal Smiles Dental Clinic, we also have on call these specialists in children teeth, and they come on board when we have children.
Dr. Gladys, why don't we talk about the signs that perhaps your child needs immediate dental attention, such that if you notice anything, this is now the call for the doctor. You cannot just wish this away and say, itaisha too.
Okay. Yeah. My advice is don't always wait for when you have a crisis.
Yeah.
What I tell parents is, think of yourself as the one having that toothache. Because I've encountered situations where a parent comes in with a child who's sick, decay, swollen jaws, and they report the child has had pain for 3 months.
Yeah.
For me, I get shocked, and my first question is, would you stay with a toothache for 3 months?
That's true.
Giving painkillers or just telling the child, Vumilia, it will get better. Don't wait for a crisis.
Right.
As soon as your child has teeth, at least at 6 months and below or even beyond, make your first contact with a dentist. Then make it a habit to visit a dentist at least once a year or every 6 months, as is recommended. The moment your child seems to not comfortable to eat a fruit like an apple, they're complaining of sensitivity, difficulty chewing, that's the most common one, difficulty chewing, bad breath, bleeding gums, teeth that don't look normal in size and shape and even color, that's your first call to visit a dentist. At any one point, avoid waiting for a pain crisis, because in some situations it could be so bad that even pain relief doesn't work as effectively as it
and they can't even articulate
the
kind of pain that they are feeling. Exactly. So it's quite unfortunate. As we're saying goodbye, allow me to give you the opportunity to let people know how they can access your services, Dr. Simiyu, so that we can actually start taking those live pictures from Gusii.
All right. To access our services, we have branches here just at Garden City, Business Park. We are Royal Smiles Dental Clinic. And we have those of us who are coming from Mombasa Road, we have Next Gen Mall. Those who live in Kiambu County, we have Ruaka, we have a branch there. Those who are in Hurlingham, we have the Yaya branch. Those of us who are in Nakuru, especially we see many fluorosis teeth. We have at Kenyatta Avenue, we have a clinic there on CK Patel building, branded Royal Smiles Dental Clinic. So even when they go online, www.royalsmilesclinic.com, they are able to book online. Depending on the location where they are.
Right, okay. So you can access a branch closest to you.
And
of course, you can catch Royal Smiles Clinic on their social media platforms. Simply type Royal Smiles and you'll be able, obviously, to get in touch with a qualified practitioner. But at the end of the day, you want your child to develop good oral habits. Well, it starts with you, like Dr. Maina said. And so when you start, they start, and they pick up the habit. And what do we have? People with Good smiles.
Good smiles.
Beautiful smiles.
Yeah, exactly.
Smiles. All right, Dr. V. Simiyu Asante Sana for being with us today.
Yeah.
Dr. Gladys, thank you so much for making time for us as well.
All right. Thank you so much, Chico.
Thank you too.
Have a nice day.
That's all we have for you on health and wellness today. Remember, we are preparing to go live from Gusii Stadium for the burial of former Cabinet Minister Simeon Nyachae. He is going to be laid to rest today at his Nyosia home. What we do understand is that, yes, there is going to be a service at the stadium and then shortly after a private burial at his home. Keep watching.